today's briefing. Bonjour tout le monde et bienvenue.
Welcome everyone and welcome to today's update on COVID-19 in New Brunswick.
Aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et l'honorable Dorothy Shepherd, ministre de la Santé. Speaking on behalf of
Les porte-paroles aujourd'hui sont la
Russell, the province's Chief Medical Officer of Health, and the Honorable Dorothy Shepherd, Minister of Health. Dr. Russell.
Thank you, Bruce. Merci. Bon après-midi à toutes et à tous.
Good afternoon, everyone.
Les citoyens du Nouveau-Brunswick continuent.
New Brunswickers continue to respond to our vaccination campaign. We are setting daily and weekly records for vaccinations against COVID-19 in every corner of the province.
0.6% of eligible New Brunswickers fully protected against the virus. We have 77.8% of our population with at least one vaccine dose. This is very good news. If we can keep up our current pace, we will reach our goal of having 75% of eligible New Brunswickers fully vaccinated against COVID-19 before the end of July. And I want to thank every New Brunswicker who has rolled up their sleeve to receive a vaccine. I also want to thank Horizon and Vitalité Health Networks, participating pharmacies across the province, and all the health providers who are working tirelessly to keep our vaccination effort moving forward. And I do hear from, anecdotally from friends and family and community members how efficient things are running and how well they really feel their experience has gone with their vaccine when they go to these facilities to get their vaccines. If you are not yet fully vaccinated, I encourage you to book an appointment for your first or second dose as soon as you can. La vaccination compte.
Getting vaccinated is the best way to protect yourself and those around you from the most serious effects of the COVID-19 virus, including severe illness, hospitalization, and even death. This is not just an opinion. We have the numbers to prove it. Over the past month, as our vaccine rollout has accelerated, the number of active cases of COVID-19 has significantly declined.
The best way to protect yourself and those around you from the most serious effects of the COVID-19 virus, including severe illness, hospitalization, and death. And this is not just an opinion, we have the numbers to prove it. Over the past month, as our vaccine rollout has accelerated, the number of active cases of COVID-19 has significantly declined. Hospital admissions due to the virus have fallen, and we are seeing fewer deaths following severe illness. The 24 active cases of COVID-19 that we are reporting today is the lowest number we have seen since early January of this year. But behind these numbers is another story: how vaccines are clearly reducing the threat that COVID-19 poses to our province. During the month of June, New Brunswick has reported 114 new cases of COVID-19. Only 4 of these cases, less than 0.5%, were seen in people who had received 2 doses of a COVID-19 vaccine. There were 36 cases in people who were partially vaccinated, that is, they had received 1 dose more than 14 days prior to becoming infected. The remaining 74 new cases, nearly 2/3 of the total, were in New Brunswickers who were unvaccinated at the time or who became infected before the vaccine had taken full effect. The same holds true for hospitalization and deaths. During the past month, no one who has been fully immunized against COVID-19 has been admitted to hospital due to the virus or died from its effects. This is a powerful testimony to the effectiveness of these vaccines in curbing the most serious effects of COVID-19. As more of us become fully vaccinated, we form a barrier to the spread of infection.
When infections do happen, we can expect they will be milder and less likely to lead to serious illness or death. However, I remain seriously concerned for those who have not been vaccinated. Nearly 200,000 eligible New Brunswickers have yet to receive a vaccine, which puts them at a much greater risk of serious illness if they contract the virus.
The COVID-19 virus will continue to circulate and find new hosts. It is this group who face the prospect of ongoing disruption in their lives. For instance, if a child becomes ill with COVID-19, that is, a child under the age of 12 who cannot receive a vaccine at this time, the unvaccinated parent has greater risks for their own health and for the public with respect to transmission than a parent who is fully vaccinated. So in that situation, the unvaccinated parent will likely be directed to self-isolate away from their family and work colleagues. So if you remain unvaccinated, you do have more of an inconvenience with respect to having to self-isolate, as well as limitations on your ability to travel. So there are risks to your own health and that of the people around you. So we can't make COVID-19 magically disappear, but by getting fully vaccinated, we can very effectively slow the spread of the virus and protect our healthcare system. Aujourd'hui, Santé publique confirme qu'il y a...
Today, Public Health has confirmed 3 new cases of COVID-19 in New Brunswick. We have 2 new cases in Zone 1, the Moncton region, in southeastern New Brunswick. One of those individuals is a close contact of a previously confirmed case, and 1 case is related to travel. There's 1 new case related to travel in Zone 3. This is the Fredericton region and Upper Valley St. John area.
Health has confirmed 3 new cases of COVID-19 in New Brunswick. In Zone 1, which is Moncton and Southeast New Brunswick, there are 2 new cases. One is a contact of a previously confirmed case, and the other is travel-related. There is 1 new case in Zone 3, which is Fredericton and the St. John River Valley related to travel. There are now 24 active cases of COVID-19 in New Brunswick, and as I noted, this is the lowest number of active cases we have seen in many months. There are now 4 New Brunswickers in hospital due to COVID-19. At this time, none of these patients requires intensive care. Bien que le nombre de cas de COVID-19
While the number of COVID-19 cases continues to decline, many New Brunswickers and their families continue to be impacted by this pandemic. Please remember to keep them in your thoughts and prayers as you go about your day.
holiday weekend of the summer season. And I know that everyone is anxious to enjoy summer to the fullest, especially those who are now fully vaccinated. We are moving in that direction, but please remember that we aren't there yet. Travel is increasing as restrictions are reduced here and in other parts of Canada. And when people move, as you recall, the virus moves. As new variants are highly contagious compared to the original version of COVID-19, infections can and will happen through casual contact. Si vous prévoyez
If you're planning to travel outside the province, make sure you know the rules that you will be required to follow when you reach your destination. I strongly recommend that you be fully vaccinated before you leave, even if this is not required by the place you are going.
outside the province, make sure that you know the rules that will be required to follow when you reach your destination. I strongly recommend that you be fully vaccinated before you leave, even if this is not required by the place you are going. Please be mindful of the risks that travel brings to you and your family. Whether you are traveling or staying close to home this weekend, it is very important that we all continue to observe the public health guidance and advice that has served us so well during this pandemic. Please continue to wear a mask in public places. Please continue to maintain 2 meters of physical distance between yourselves and others whenever possible. Please continue to wash your hands regularly and thoroughly and to use an alcohol-based hand sanitizer between washings. Please continue to be watchful for symptoms of COVID-19. The new variants may appear like a summer cold or mild flu, and please get tested when symptoms appear. It is very, very important that we continue to do this and not make assumptions about what could be causing the symptoms. Please get tested for COVID-19. I actually had to have one of my children tested last week. They had a fever. It turned out to be negative, but it's very, very important that we take the time to get people tested. We have come so far, and we are making such great progress. Please let's not lose momentum we have created over the past month. We are getting through this. Let's get to the finish line. It is in sight, finally. So let's make sure we all get there together, healthy and safe. Thank you very much.
Good afternoon. Bonjour. Just last week, all New Brunswickers became eligible to book an appointment for their second dose of a vaccine once 28 days has passed since their first dose. Since then, our province has repeatedly broken records for the number of appointments booked in a day, the number of vaccines administered, and the number of people vaccinated in 1 week. I want to thank everyone who has been vaccinated so far, as well as those who have appointments coming up in the days and weeks ahead. If you haven't had the chance to book your second dose appointment yet, I can tell you that we have lots of availability and no shortage of vaccines. You can book an appointment through Horizon and Vitalite Health Network clinics by visiting www.gnb.ca/book-a-vaccine. or by contacting a participating pharmacy. I'm thrilled that more than a third of eligible New Brunswickers are now fully vaccinated. As of today, 33.6% have received both doses of a vaccine. I'm also pleased that the percentage of New Brunswickers aged 12 and older with their first dose is continuing to rise. 77.8% have now received at least one dose. We are continuing to book appointments for first doses, and if you haven't done so yet, I encourage you to schedule yours today. Even tomorrow, on Canada Day, there will be clinics available in several communities, including Campbellton, Fredericton, Miramichi, St. John, and Tracadie. Some pharmacies will also have appointments available. In Sackville, for example, the Corner Drugstore will be offering a mass vaccination clinic at the Tantramar Civic Centre. I want to thank everyone working hard at Regional Health Authority clinics and at pharmacies, even on a holiday, to ensure New Brunswickers are able to receive their vaccines as quickly as possible. Every day we are making impressive progress in our vaccination plan and getting closer to eliminating restrictions by moving forward on our path to green. Based on yesterday's numbers, New Brunswick is leading Atlantic Canada provinces with our percentage of fully vaccinated people ages 12 and older. We are also ahead of British Columbia and Quebec. With less restrictive rules now in place and a long weekend coming up, I know we were all looking forward to engaging in activities that have not been permitted for a long time. Now that we are in phase 2 on the path to green, we are able to welcome our family and friends from other provinces with vaccination or isolation guidelines still in place, and we can plan trips of our own outside of New Brunswick. I encourage everyone to enjoy these new freedoms, but please do so safely. For now, the mandatory order is still in place and certain rules do apply. We need to continue to wear masks in indoor public spaces and physically distance from each other. If our vaccination rate continued to rise at such an impressive rate, it is very likely that by New Brunswick Day on August the 2nd, we will be able to move to phase 3. At that point, we can lift the mandatory order and remove all restrictions, including the requirement to wear masks. To reach that point, we need all New Brunswickers to do their part. Book your vaccine appointment if you haven't yet, and encourage other people in your life to do so as well. Getting vaccinated is the only way to ensure we are all protecting ourselves and our loved ones. And it's also the only way we can all return to green. If you visit the Government of New Brunswick's Twitter, Facebook, or Instagram page today, you'll see that Montreal Canadiens goalie and New Brunswicker Jake Allen took time out of his busy schedule to encourage New Brunswickers to get vaccinated. Thanks to Jake for that message. And I just want to say that even though they beat my Toronto Maple Leafs, I'd like to be able to say that the very best team beat ours. So I really hope and wish the Habs all the best in their search for the Stanley Cup, and look forward to congratulating them on their win. I know we can achieve our next target of vaccinating 75% of the eligible population with both doses. We will do it by taking the same approach we have throughout this pandemic, by working together toward a shared goal. Keep up the great work. Thank you. Merci.
Thank you.
Thank you, Minister. Thank you, Dr. Russell. Merci beaucoup à vous deux, Madame la Ministre et Dr. Russell.
Thank you to you both.
Questions from members of the media. Each reporter will have one question and one follow-up. You have the right to pose your question in the official language of your choice. Please ensure your microphones are placed on mute. Maintenant, nous allons procéder.
We will now proceed to reporters' questions. You can ask your questions in the official language of your choice. Every reporter can ask one question and one follow-up question. And please make sure that you turn off your mics. We're going to start with Michel Corriveau, Radio-Canada. Thank you, Bruce. So I have a question for Dr. Russell. So, Dr. Russell, since we reached 75% of the people vaccinated for the first dose, things are not moving very quickly beyond the 77% about. So what can we do to encourage more New Brunswickers to get vaccinated? Michel, could you please move closer to your mic, and could you read your question again?
Ron, please be close to your microphones. Peux-tu répéter ta question?
Can you repeat your question, please? Okay, so now can you hear me better? Yes, thank you. So this is a question for Dr. Russell. Dr. Russell, ever since we reached the 75% target for the first dose, the rate is not increasing quickly. So what else can we do to encourage New Brunswickers to get vaccinated for their first doses? Well, hello, Michel. So I think that this week we vaccinated more than 14,000 New Brunswickers in one day. So we have enough capacity. We just need to keep encouraging our family members, our friends, our loved ones, community members, and your coworkers to get vaccinated. We can certainly reach our goal. Once again, the reality is that we have the doses, we have enough vaccines, we have the capacity, and also you can help your family members and your friends with transportation options and keep encouraging them. Some people, it's not that they're vaccine hesitant or they're against the vaccine. It's just that they didn't really think about this enough. So that's why it's very important to have conversations with people around you. We have many clinics that are available tomorrow for July 1st. So if you don't have anything else planned for tomorrow, well, it's a chance tomorrow to get vaccinated. Mr. Corriveau, do you have a follow-up question? Yes. So given how it works now, do you think that we will reach the green phase before August 2nd? Well, it's difficult to say. We have the capacity and we have enough vaccines. So if people book their appointments and show up to clinics. Thank you, Dr. Russell.
Well, I'll just add that we certainly do have clinics happening tomorrow on Canada Day, certainly in Campbellton, Fredericton, Miramichi, St. John's, Acadie. And we're just encouraging everyone to call their pharmacy if they want to set up a time. Many pharmacies are vaccinating on the weekend, and we really just need to keep encouraging that. We certainly are still seeing the first dose numbers increase, albeit slow, but you remember that it was a bit painful for that one full week that we had to take extra time to get to our 75%. But we're hoping that everyone who has had a first dose will certainly make themselves available to get their second. And we need to push, and let everyone know that, our vaccinators could use a break. And if we can give them that August 2nd date and make it happen, they certainly are doing a great job for us, and we want to thank them.
Merci, Madame Ministre, Dr. Russell. Silas Brown, Global TV. Silas? We'll cycle back. Jennifer Baza, CTV.
Good afternoon. I just had a question. So I was wondering, some pharmacists have said they have noticed less of the younger population getting vaccinated recently. Is that at all a concern?
Well, it's really important that everybody who can get vaccinated is vaccinated. I do hear of anecdotally that sometimes people, again, who weren't planning, thinking, it wasn't top of mind, but if they happen to be in a place where, such as a pharmacy, where they had made announcements over the PA system that if you need a vaccine, that they had some available, that works really well for people who it wasn't on the forefront of their mind. And then also pop-up clinics. Again, if you can encourage people to go to any of those clinics, that would be helpful. We do want to get as many young people vaccinated before the fall as possible, obviously. And obviously, we're trying to meet our target for August 2nd as well.
Thank you, Dr. Jennifer. Do you have a follow-up today?
Yes, I do. I was curious, will there be different restrictions for those who are completely unvaccinated in the future?
With respect to case management, technically, yes. It'll always depend on the risk assessment by the medical officer. So if there is a positive COVID-19 patient who has close contacts who are not vaccinated, most likely that would result in the unvaccinated close contact to be required to self-isolate. So that's what we expect right now. And obviously there are some destinations who require 2 vaccines to travel. So, and there are probably some workplaces where if a person was not vaccinated, they would have to continue with masking. So it'll keep evolving, and we'll continue to watch and collect data on what we're seeing. But certainly the unvaccinated population will be at the highest risk for severe outcomes, hospitalizations, and ICU admissions.
Thank you. Vicky Hogarth, CHCO TV.
Thank you, Bruce. Dr. Russell, we know that mixing vaccines is just as effective, but is there any early evidence to suggest that mixing vaccines could potentially be more effective at creating a stronger immune response?
Great question, Vicky. They have noted that there are some instances where it does show an increased immune response with a different vaccine. However, there's not enough data to show how long that immunity lasts. And actually, we're still monitoring that with all the vaccines. We're monitoring, what the effectiveness is with respect to the different intervals, and then how long the immunity lasts based on 2 doses at different intervals, et cetera, because we are having the conversations about next steps with respect to boosters after everyone has had their second doses and when that would start to be part of our rollout.
Ms. Hogarth, do you have a follow-up?
Yes, I do, Bruce. Thank you. Dr. Russell, do we know approximately how long a person who is fully vaccinated and has no symptoms would be able to host the virus for? Is it significantly less time?
You mean how long they would be contagious? So
Yeah.
Are you asking about the incubation period or the period
Yeah.
of contagiousness?
I guess both, actually.
I don't have that data in front of me. I think what I do know right now is that what we're seeing across the country is the number of cases decreasing as the vaccination rates have gone up. And we are seeing that whoever is not vaccinated, those are the people, by and large, I think I quoted 86.3% of Albertans who are hospitalized right now are unvaccinated. If they're in the hospital for COVID reasons, 86% of the hospitalized patients with COVID are unvaccinated. So what we're looking forward to in the future, again, is just to continue to monitor the severity of symptoms that require hospitalization, because those are going to have the impacts on our healthcare system that we're trying to avoid.
Thank you, Doctor. Bobby Jean McKinnon, CBC. Bobby Jean. Bobby Jean, you're going to have to get closer to your microphone, please, and start over. We didn't hear you. Thank you.
I'm sorry about that. Dr. Russell, can you hear me?
Can you go a
It's
little louder
really-
there?
It's really faint. There's no way to
Sorry,
crank
can
it.
you hear me now?
Okay.
Can you hear me now?
Yes.
Okay. Dr. Tam said last week that at least 80% of the eligible population will have to be double dosed before protective measures are fully lifted if the Delta variant becomes the dominant strain. What will that mean for New Brunswick's path to green and our 75% target?
I'll start, and if the minister wants to add, I think what we know right now, Bobby Jean, from this entire pandemic is the only thing that we can guarantee is that there are no guarantees. So at this moment in time, you know, with all the information that we have across Canada, the numbers going down, we're grateful to see the fact that overall Canada is doing much better with respect to case numbers and hospitalizations and ICU admissions. And as I mentioned to the last reporter, the overall pattern that we're seeing is that people who do end up in the hospital are mostly those who are unvaccinated. So there's no question that protective measures should remain in place until we get the majority of the population vaccinated with 2 doses. And in fact, there are some jurisdictions who attained their goal of vaccinating their population, and then they had to walk back on some of the restrictions that they had lifted. In places such as Israel, they had to reinstate their mask policies. So never say never. I think we're just going to keep on the path that we're on, try to get as many people vaccinated as we possibly can, and continue to monitor the situation.
I'm just going to add to Dr. Russell's response and say that, you know, we have relied on public health for their information, and we've always, through our COVID reality and our experiences, that we will make the best decision we can make on any given day and the information that's available to it. So as we work together, it will certainly be be a team effort. And I also think that we've given New Brunswickers reasons to always attain for the prize. And I think that seeing the numbers that we're seeing now and seeing how second doses are really ramping up and going so well, that I think New Brunswickers understand that we need this component of vaccine levels in order to have the freedom that we all want. So as we see first doses continuing to increase, albeit slow, they're still increasing. We're going to keep pushing.
Thank you. Ms. McKinnon, do you have a follow-up?
Yes, I do. Thank you. Dr. Russell, the CDC still says the safety and efficacy of mixed product series have not been evaluated, that both doses of the series should be completed with the same product. This is different than your advice and Nancy's advice. What do you say to New Brunswickers who are confused by this mixed messaging they're hearing on this issue?
Well, obviously there are many different sources of information for different jurisdictions, and for Canada, again, we follow Health Canada and Public Health Agency of Canada and NACI guidance. So the best advice that I can give right now is that by having 2 doses on board of whichever vaccines you have is the best protection that we can offer right now. Again, we haven't seen any data otherwise at this point in time here in Canada. So again, we will keep monitoring the situation, but we will continue to offer people whatever vaccine type we can, whether it's a different mRNA vaccine, whether you had Pfizer for the first dose and Moderna for the second, or Moderna for the first, or Pfizer for the second, et cetera. We will continue down that path.
Thank you, Ms. McKinnon. Thank you, Doctor. Thank you, Minister. Savannah Odd, Telegraph Journal. Savannah, we can't hear you. We'll just move ahead to Andrew Waugh from,
Okay.
Savannah, go ahead.
Okay. There we go. Dr. Russell, you mentioned that about 200,000 people aren't vaccinated yet, and while children under 12 can't get the shot, unvaccinated people they're in contact with remain at risk. Is there potential for that to cause a spike that requires more restrictions to return?
Well, first of all, we'll always be concerned about anyone who's not vaccinated, whether they're a child or an adult, number one. Again, because we know that they are at a higher risk of severe outcomes. Although with children, we haven't really seen a lot of transmission with kids. We haven't seen a lot of, we've seen mild symptoms or asymptomatic cases. So we are encouraging as many people as possible to get vaccinated to protect the children who can't get vaccinated, obviously because of their age at this point in time. And again, we haven't seen widespread transmission in school settings up until now. That doesn't mean that we won't, but certainly with our approach with so far with public health in terms of our contact tracing and case management, et cetera, I mean, that will continue. But it probably will be something that, again, the parents of the students who can't get vaccinated, if those people could all be vaccinated, then it's that extra layer of protection, a cocooning, so to speak, of those people who can't be protected with a vaccine. So, yeah.
Ms. Odd, do you have a follow-up?
I do. Thank you, Bruce. Also for Dr. Russell. So I guess, is there potential for a spike, this fall maybe when children are back to school if we don't have a vaccine for children under 12? And I guess where are we on that approval process to your understanding?
Well, that is something that's happening at the federal level, and Pfizer is expecting to provide a submission to Health Canada in early fall for usage of vaccine in children aged 5 to 11 and 6 months to 5 years of age. So that's very, very encouraging at this point in time. So we do want to be in a position to be able to vaccinate the remainder of school-aged children this fall.
Thank you both. Andrew Waugh, Brunswick News.
Yeah, hi. First questions to both Dr. Russell and the Minister. So last week, the World Health Organization issued a statement saying, urging countries to keep mask rules in place, particularly given the rise of the Delta variant. Is New Brunswick planning on ignoring that advice, or are we going to walk back the mask rules, the lifting of mask rules?
You want me to start? Yeah. Well, as I mentioned earlier in the press conference, never say never. There are jurisdictions who have had to walk back their masking policy. And as Minister Shepherd said, we continue to follow the data and the evidence, and we will continue to make decisions based on the current and most up-to-date evidence. So as of right now, our situation in New Brunswick is quite stable, and we just are very keen to continue to vaccinate our population and get as many people vaccinated with 2 doses as possible. We have opened up to the rest of Canada at this point, so people are traveling more, so there are risks that are elevated with travel and with the variants. And as more international travel happens, we'll keep an eye on that as well. But certainly our data is what has been driving most of our decisions in terms of when we make policy decisions to protect the population of New Brunswick. So we'll continue to monitor that.
I think we've talked about the fact that we, in partnership with public health, make our decisions based on the most relevant and up-to-date information that we have access to on any given day. And that's going to continue. I think about past seasons where many of us have spent money on preventative measures for getting colds and the flu, and quite frankly, we've seen how inexpensive a mask is, and washing our hands and keeping our distance from each other has really prevented influenza. We had 1 case in all of last year. And so we know that there are going to be some people who see the benefits of this and may want to continue. But as a government policy, we'll always work hand in hand with public health to determine if we need to make any changes going forward.
Mr. Waugh, follow-up?
Yeah, sure. So speaking of data, the UK's recorded 26,900 cases today, largely because of the Delta variant. What do you think about that data?
Well, my understanding is that the majority of those cases are actually in unvaccinated people. We are continuing to look at the statistics across Canada. The numbers keep coming down, which is really great. But what we are seeing is the pattern of hospitalized patients being mostly unvaccinated. That's what our focus has to be right now, is getting our population vaccinated to protect them against hospitalization and severe outcomes and ICU admission, so we can continue to protect our hospital system.
Thank you, Mr. Waugh. Thank you, Doctor. Thank you, Minister. Adil Ibrahim, CBC.
Thank you. This question is for Dr. Russell. Of the 200,000 people that you mentioned, aside from the children, who can't get vaccinated? And Minister Shepherd, do you plan to create a policy distinction, like travel restrictions, between the people who choose not to get vaccinated and the people who physically can't?
I'll start with the contraindications. So each vaccine has a list of contraindications, and sometimes there are alternatives. If you have an allergy to one of the components of one of the vaccines, then you will be offered a different vaccine. So that actually happened to one of my staff recently. They went to get one of the vaccines and were turned away because they did have a contraindication and were rebooked for another clinic where the other vaccine was offered. So again, it would really be rare that somebody had a contraindication where they couldn't receive a vaccine of one of the three that are being offered right now. However, it still can happen. So, will the numbers be large? No, they won't be large numbers. But in terms of the difference between hesitancy and contraindications where people actually can't, and then again, there's a pool of people who are it's just not in their brain space right now. It's just not on their radar. Those are the people that we really need to be able to try to reach right now, because they are most likely to eventually get a vaccine. It's just not a huge priority for them right now. But the majority of the population, as you can see with our numbers as they continue to climb, for the majority of New Brunswickers, it is a priority and they are making it happen. But for some people, they need more encouragement. They might need extra help with transportation or actually booking an appointment, and they may be more likely to be amenable to those pop-up clinics that are offered in different places. So we do have different approaches to target people with respect to communications and the types of flexibility that we're trying to offer. And at this point in time, again, that our number one priority is getting people vaccinated, because it is the best protection that we can offer to protect our healthcare system right now.
And I'll jump in on that second part of the question, which is that, we have stated publicly, tabled our plan on May 27th, that when we reach 75% of our 12 plus population vaccinated with 2 doses, we will end the mandatory order and lift restrictions. If newer information comes forward, and with in conjunction with public health, we need to make any decisions, that would contradict that, we certainly would like to hope that we can give our population, notice. But right now, the plan is that 75% of our 12 plus population vaccinated with 2 doses ends the restrictions and the emergency order in our province.
Thank you. A quick follow-up, Ms. Ibrahim?
Yeah, I just wanted to clarify with Minister Shepherd, that last part of your question. Could you just explain what you mean by what would happen if something changes after the emergency order ends?
Well, I think it's really important to understand that we are making the very best decisions that we can on the available information on any day with our COVID planning. And right now the plan is that when we reach 75% of 12 plus population vaccinated with 2 doses, the emergency order will be lifted, and restrictions will be eliminated as well. So anything over and above that has to be with new information, and we'll proceed as each day brings information of the day. We won't make changes unless there are some serious serious information that's brought forward to our attention.
Thank you, Ms. Ibrahim.
Just to confirm, so you're not considering any specific restrictions for people who choose not to get vaccinated for now, but it's a possibility in the future?
We will go on public health's advice with that, but right now, as of 75% of our 12+ population is vaccinated, we are lifting restrictions.
Thank you.
Thank you. We're going to cycle back to Silas Brown with Global TV.
Just a quick check. Can you hear me?
Yes, loud and clear, pal.
Wonderful. So I just kind of following up on some of that about the emergency order and some of the things that I heard earlier on, as well as in response to some questions about, potentially people who would be close contacts who hadn't been vaccinated. They have to isolate after we reach that green threshold. I'm wondering what the authorities to ask people to isolate or to impose mask orders would be if the emergency order is lifted, or if that would necessitate either legislative change or a reintroduction of the emergency order.
I'm going to start and then let Dr. Russell pick up. It's really important to know that all through our COVID experience, we have made decisions based on the most up-to-date information of the day. And public health is certainly, been our guidance through all of this. And we've been very successful in managing COVID throughout these past 16 months because of our relationship with public health and the diligence for which they've performed their responsibilities. So what I'm going to say is that if there isn't an emergency order, I'm going to say that our public health officers have a tremendous amount of authority in making decisions. And if we need to back that up in some way, I'd certainly look at it. But right now, you're talking in hypothetical, and we're going to go forward with our plan that we have today.
So we are in a transition period with vaccination rates going up and different public health measures being relaxed. We are moving from a pandemic state to a more endemic state, which means that COVID will be part of our normal everyday life. It'll be just another communicable disease that's reportable to public health. And all of the guidance and authority that we have under the Public Health Act is still in place and has been in place throughout the pandemic. However, we were using the umbrella of the emergency, the mandatory order to really capture all of the things that needed to be done from a public health perspective, while being able to also ensure that if there was enforcement needed for any of these measures, then those things were all in place. So moving forward, we will have more conversations about what types of things we will continue to need, but there will be a lot of things that will just fall under the Public Health Act, as was the case prior to the pandemic. So we'll continue to have those conversations as they evolve in terms of what types of things we will need to be able to make sure that people adhere to when we have public health restrictions that have to be in place. But again, prior to the pandemic, we would issue orders under the Public Health Act in situations where we had to protect the public.
Mr. Brown, do you have a follow-up?
Yeah, just for Dr. Russell, I'm wondering if there would be anything that you think wouldn't fall under the Public Health Act that may need to be clarified in law. I mean, I'm not sure, and you likely know this better than I would, about if you can compel people to isolate under the Public Health Act, because I do know that is one of the pieces that is in the emergency order. So just wondering if there's anything that maybe that you would like to see clarified legally or in the Public Health Act that you would feel could be necessary to respond to flare-up or anything else that we may experience as this becomes endemic.
Really great questions, Silas, and certainly anything that does fall under the Public Health Act under that authority, we do have the capacity and the authority to issue orders to isolate people, etc. So that I know we can do. If there are other things that fall outside of the Public Health Act, then we definitely will make sure that through Cabinet in our discussions with JPS that we would make sure that those things are either in place or something that can be easily put into place if necessary.
Thank you, Mr. Brown. Ladies and gentlemen, that concludes today's update. Voilà la fin de notre mise à jour. Merci beaucoup.
This concludes today's update. Thank you.